Since we are talking about the contractile properties of skeletal muscle fibers, let's look at summation. Adding together of individual muscle contractions to give a strong muscle contraction is called summation. Contractions of a whole muscle, they can be of varying strengths. Summation means to increase the intensity of overall muscle contraction. The number of fibers contracting within a muscle, it depends on the extent of motor unit recruitment. The number of muscle fibers innervated by a single motor nerve fiber is called a motor unit. The muscle fibers that compose a motor unit are dispersed throughout the muscle, and each muscle it consists of a number of intermingled motor units. Does it comes to your mind that why summation is possible in muscle? Because my dear, the contractile process it has no refractory period. Therefore, summation of contractions can occur. Summation occurs in two ways: spatial summation and frequency summation. Spatial summation is the multiple motor unit summation, and it occurs by increasing the number of motor units contracting simultaneously. And it is also known as multiple motor unit summation or multiple fiber summation. The frequency summation, it occurs by increasing the frequency of contraction of individual motor unit. There is no increase in the number of motor units. Same number of the motor units they contract repeatedly. Tetanization is an important concept, and it might be your Viva question. Um, it can also be termed physiologic tetanus. Tetanization is defined as sustained muscle contraction brought about by high rate of action potentials from motor nerve. When the frequency of stimulation is increased to 40 to 60 times per second, there is complete fusion of the individual muscle contractions, and this condition is called tetanization, and it occurs at a critical frequency. In other words, in tetanization, there is sustained contraction without relaxation when the muscle is stimulated at a rapid rate. And the frequency of the stimulation at which the tetanization occurs is known as the tetanizing frequency. Now, keep in mind that tetanization is different from tetanus or tetany, because tetanus is a disease which is caused by a bacterium called Clostridium tetani, while tetany, it's a manifestation which occurs due to hyperexcitability of muscle due to multiple causes. This staircase effect, or it's also called trappe or trap, this trap is a progressive increase in the force of contraction till it becomes constant and maximum. The staircase effect occurs when, after a period of rest, maximal stimuli are applied at a frequency below the tetanizing frequency. And warm up exercise is based on this phenomenon. A cause of the staircase effect is the increased availability of calcium because some calcium ions of the first contraction they remain in the cytoplasm when the second contraction begins, thereby causing second contraction to be stronger than the first. Muscle fatigue is the loss of the capacity of muscle to respond to stimulus. It's a condition in which the contractile and metabolic processes in the muscle they fail to continue. Keep in mind that muscle fatigue is a defense mechanism that protects a muscle from reaching a point at which it can no longer produce ATP. Muscle fatigue is associated with the energy reserves depletion in the muscle, which is the energy reserve, it is glycogen, and then the fatigue that shows the accumulation of lactic acid in the muscle. This muscle fatigue is also associated with decreased neuromuscular transmission, decreased blood flow, and even hypoglycemia. There is local increase in the ADP and inorganic phosphate to form the ATP from the ATP breakdown. And also, in case of muscle fatigue, there will be accumulation of extracellular potassium. You should know that muscle cells they cannot divide mitotically to replace lost cells. So when a muscle is damaged, limited repair is possible, which is a local phenomenon. But with extensive injury, this limited local mechanism it is not adequate to completely replace all the lost fibers, and in that case, the remaining fibers they often hypertrophy to compensate. Aging is associated with a loss of muscle mass, and this mass loss that is called sarcopenia. The age related decline in the muscle mass it begins around age of 25 and then it occurs across the lifetime. Actually, aging results in a loss of fast fibers and an increase in slow fibers. Let's move to our next topic of remodeling of muscle, which could be hypertrophy or it could be atrophy. Muscle hypertrophy is increased muscle mass in simple words. So, when the total mass of a muscle increases, this is called muscle hypertrophy. This can be achieved through forceful muscular activity for a long period of time, like in 6 to 10 weeks, And this kind of hypertrophy is seen in case of weightlifting. Keep in mind that in muscle hypertrophy, there is increase in size of the muscle fibers. Plus, there is also increase in the size of myofibrils, the cytoplasmic reticulum, mitochondria, myoglobin, glycogen, lipids, and blood vessels. In muscle hypertrophy, there is no increase in the number of muscle fibers. The muscle enlargement or thickening, whatever you call it, it comes primarily from an increase in the diameter of the fast glycolytic muscle fibers. And most of the fiber thickening, it results from increased synthesis of myosin and actin filaments. Hypertrophy, it occurs to a much greater extent when the muscle is loaded during the contractile process, because then there occurs an increase in the number of actin and myosin filaments in each muscle fiber, causing enlargement of the individual muscle fibers. But additionally, some of the myofibrils themselves, they have been observed to split within the hypertrophying muscle to form new myofibrils. Well, the other model is muscle atrophy. When the total mass of a muscle decreases, the process is called muscle atrophy. When a muscle remains unused for a long period, the rate of decay of the contractile proteins occurs more rapidly than the rate of replacement. As a result, muscles actin and the myosin content decreases and it becomes weaker. So the causes of muscle atrophy, they include lack of activity, and in that case it is called disuse atrophy, and you can see it in a muscle which is placed in a cast. Similarly, lack of nutrition and lack of hormonal stimulation, they are also included in the causes of atrophy among uh, other causes, such as the muscle denervation, because in this case muscle no longer receives contractile signals. To learn the effects of muscle denervation, you should know that when a muscle loses its nerve supply, atrophy begins almost immediately, and after about 2 months the degenerative changes, they begin to appear in the muscle fibers. And in the final stage of denervation atrophy, most of the muscle fibers are destroyed and replaced by fibrous and fatty tissue. And the fibrous tissue that replaces the muscle fibers, it has a tendency to continue shortening for many months. And then this condition is called contracture development. Several hours after death, all the muscles of the body go into a state of contracture, which is called Reiger Mortis. In this condition, the muscles contract and become rigid even without action potentials. This rigidity, the rigor mortis, it results from the loss of ATP because ATP required to cause separation of the cross bridges from the actin filaments during relaxation process, and dead cells they cannot produce any more ATP. So the muscles they remain in rigor for about 15 to 25 hours until the muscle proteins deteriorate, resulting from the autolysis caused by the enzymes released from lysosomes. Let me now give you a brief introduction to the common diseases of nerve and muscle. First, let's discuss the demyelinating diseases. Normal conduction of action potentials, it relies on the insulating properties of myelin. And defects in myelin can have adverse neurological consequences. One example is multiple sclerosis, which is an autoimmune disease. Multiple sclerosis starts between the ages of 20 and 50, and it affects women twice as often as men. So what happens in multiple sclerosis? The antibodies and white blood cells they attack myelin, causing inflammation and injury to the sheath, and eventually the nerves that the myelin surrounds. So this loss of myelin it leads to hyperpolarization and the failure to conduct the action potentials. In multiple sclerosis, physiological defects they include muscle weakness, fatigue, diminished coordination, slurred speech, blurred or hazy vision. Also, there are bladder dysfunction and the sensory disturbances. Looking at the diseases of muscle, let's go through the muscular dystrophies. The term muscular dystrophy is applied to the diseases that cause progressive weakness of skeletal muscle. And in the case of muscular dystrophies, mutations in the genes they are a prominent cause. There are two main muscular dystrophies: Duchenne muscular dystrophy and Becker muscular dystrophy. Mutations in genes that code for enzymes which are involved in the metabolism of nutrients and the production of ATP, they can cause metabolic myopathies. Uh, these metabolic myopathies they cause exercise intolerance and muscle breakdown due to accumulation of toxic metabolites. Another interesting pathology that is Lambert Eaton syndrome, and this revolves around the neuromuscular junction and uh, some defects and lesions in the neuromuscular transmission, and you will get a scenario something like this. and then you will answer the related questions. Lambert Eaton syndrome is another condition which resembles myasthenia gravis. In this condition, muscle weakness is caused by autoimmunity against the calcium channels in the nerve endings at the neuromuscular junction. And this autoimmunity, it decreases the normal calcium influx that causes the acetylcholine release. So, proximal muscles of the lower extremities are primarily affected, producing a waddling gait and difficulty in raising the arms. Actually, the mechanism which is involved, what happens that repetitive stimulation of the motor nerve, it causes accumulation of calcium ions in the nerve terminal, and then it increases the acetylcholine release, leading to an increase in the muscle strength. Now, this is in contrast to the myasthenia gravis, in which the symptoms they are increased by repetitive stimulation. Interestingly, Lambert-Eaton syndrome is regarded as a paraneoplastic syndrome, and it is associated with the cancers of lungs, stomach, colon, prostate, bladder, kidney, or even gallbladder. Um, there is a drug, DAP. This is basically a diaminopyridine, which is used as the treatment of choice in Lambert-Eaton syndrome, because in this case, the anticholinesterase drugs they are not very effective.